Okay. Now, another method to detect your mycobacteria is via the molecular and rapid methods. So these are now used, no, sa especially in the Philippines, no, for faster diagnosis and faster detection of the bacteria. Imagine if you grow them via culture, it would take you 6 weeks na before you know that there is a bacteria. So sometimes no namatay na ang patient or kaya dugay na gid kay nakalintan na sa patient nga ay nagpa-culture man di ko, 'di ba? So this is really a big help no for the diagnosis of the patient for Mycobacterium tuberculosis. The Gene Expert MTB or the RIF test or the rifampin test. Okay, so this uses a cartridge. Okay, this is a cartridge based PCR test. Okay, as you can see in the machine, gamay lang kay ni siya nga machine, but it uses a cartridge. Okay, and it confirms the Mycobacterium tuberculosis from the sputum. It detects rifampicin resistance, which is a marker for multi-drug resistant tuberculosis. Okay, so now to ensure optimal recovery of mycobacteria from clinical specimens, many specimens must be processed before inoculation onto culture media. Okay, okay, so ayan, no, so yan yung ating gene expert na MTB RIF test. Okay, so ang specimen dapat good quality, no, sputum siya. Okay, hindi pwede ang salivary nito kasi napakamahal nito and sayang lang if salivary yung specimen tas walang nakita, walang na-detect na gene no ng ating TB, ng ating MTB. All right? Also there are DNA probes and sequences, all right? So ang DNA probes and sequencing they detect rapidly the MTB complexes, mga Mycobacterium avium complex, and other species of the Mycobacterium. Okay, so right now in the Philippines, again, we already have this, no, especially sa SPMC. Okay, they're in their molecular biology na laboratory, we have already these machines, no. So good to know because it helps no Filipinos be diagnosed faster with the tuberculosis and it can speed up the treatment of it can speed up the diagnosis for the patients. Okay, all right, now um what happens to the sputum specimen when it arrives in the laboratory, by the way? So it goes with the decontamination. Okay, so it requires to be decontaminated and undergo digestion. Okay, so bakit kailangan siya ng decontamination and digestion? It is to assure oral flora of the specimen is removed. Alright, so the purposes of the digestion decontamination process, no, is to liquefy the sample through digestion of the proteinaceous material of the specimen and also to allow the chemical decontaminating agent to contact and kill the non-mycobacterial organisms. So para ma-remove yung mga contaminants. Now, we have these agents for decontamination and digestion. We have this sodium hydroxide. Okay, sodium hydroxide or the NaOH, which has a usual concentration of 2%, 3 or 4%, that serves as a digestant and decontaminating agent. Now, we also have another agent, the N-acetyl L-cysteine or the dithiothiol, okay, as the mucolytic agent in combination with the 4% sodium hydroxide, which is a decontaminating agent. Okay, so this technique no is recommended for decontamination and digestion of our specimen. Again, sputum is full of mucus, 'di ba, and other bacteria. So, 'di ba, moagi po siya sa atong mouth, no? So it can also abhor, 'di ba? It can also abhor the normal floras. Okay, so we use decontamination and digestion methods. Okay, so one of the most common no na gamit for decontamination and digestion is the sodium hydroxide, and the recommended technique for decontamination and digestion is the combination of N-acetyl L-cysteine, which is a mucolytic agent, and 4% sodium hydroxide, which is a decontaminating agent. Okay, we also have this agent Zephyran or the benzalkonium chloride, in addition with the trisodium phosphate. Now, trisodium phosphate liquefies the sputum rapidly, but it requires a long exposure time to decontaminate. All right. Now the benzalkonium chloride or the Zephyran shortens the exposure time. So, in combination with the two, no, so para mas mapadali yung ating exposure for the decontamination, we have this combination. All right, so how do we treat Mycobacterium tuberculosis? Okay, so there are first-line anti-tuberculosis drugs, which are the isoniazid, okay, the rifampicin, pyrazinamide, the streptomycin, and the ethambutol. Okay, apat po sila. All right. So these are the four first-line anti-tuberculosis drugs. Okay, or the RICE, R-I-S-E, rifampicin, pyrazinamide, isoniazid, streptomycin, and the ethambutol. Okay, now if sorry, if resistant na ang bacteria with the first line drugs, no, we have the second line agents, the cyclosporine, ethionamide, p-amino salicylic acid, the viomycin, and the capreomycin. Okay. Now, the multi-drug resistant tuberculosis is increasing concern siya up to this year. No? So, 8% of isolates are resistant to one or more antimicrobial agents. When you say multi-drug resistant tuberculosis, it means the isolates are resistant to one or more antimicrobial agents. Alright, so treatment is typically involves in a 9-month course of therapy with isoniazid and rifampin, usually once per day the first month and twice a week thereafter. So many regimens also include a 2 to 8 week initial course of streptomycin or ethambutol. Most individuals clear their sputum of AFB within the first 2 months of treatment. Now the pyrazinamide may be added to the regimen if there is a suspicion of lowered cellular immunity and a need to obtain bactericidal levels of antimycobacterial activity intracellularly in the macrophages. Okay, so now the pyrazinamide is usually recommended for a shorter course, initially along with isoniazid and rifampin. Again, pyrazinamide, is usually recommended for a shorter course, initially along with the isoniazid and the rifampin.